what has happened is that we've basically locked up the kids for about a year and a half now. So they are in effect virgin soil and naive to the virus. So it's entirely possible that you'll get more infections amongst kids because they're the only ones that haven't been properly exposed to the virus. Whether it'll prove virulent in children is a completely separate matter. But about the third wave, what we do learn from the flu pandemic of 1918 is that it presented roughly about 2.5 to 3 waves. And we're dealing with a similar respiratory mucosal pathogen here. The first wave is a small wave. And this is immediately followed by mitigation measures and lockdowns and all kinds of non-pharmacological interventions to try and affect transmission. But obviously, you get fatigue associated with these mitigation measures, and you have a large, and also there is selection pressure on the virus to mutate because you are doing your measures are precisely preventing the virus from spreading. So all selection pressure would be on the virus to find more ways of transmitting itself and propagating itself. Add to that fatigue with mitigation measures and prevention, and you get a second wave, which is usually massive because you have a large vulnerable population. Right now, once you're past that, the third wave, as it happened in the flu pandemic of 1918, was a sort of intermediate wave in terms of intensity between the first and the second wave, because again of mutation and fatigue, but you have a smaller vulnerable population that remains to be affected. The only thing that's different is because this time around, this is the first time in the history of humankind that we are actively vaccinating individuals in the middle of a pandemic, which is going to affect the trajectory of this pandemic.